Okay, let's walk through the bill now.
So what this bill does is prohibits providers from performing procedures on children for gender transitioning or gender reassignment. As we go to page 2, there's definitions: child, what a child is; healthcare provider, what a healthcare provider; physician. As we go on to page 3, it's basically where it starts out. On page 7 is the most important part. No physician or healthcare provider shall. And then basically we're going to start going through the definitions here.
Already mentioned this is happening in Wyoming. We had a discussion on the floor about, oh, well, it's only happening to adults, and that was later confirmed by UW that it is happening with children in some of our tax-supported institutions. As far as the topic of gender affirmation care, this really is the practice of ignoring the real issue. The underlying conditions of gender dysphoria are generally in the anxiety and the depression realm. These are symptoms of something that is bigger. Let's take the idea of, say I had someone come into me and they're telling me that they are too fat, and I can visibly see that this individual is too thin. Their body mass index is low. If I immediately affirm that person and say, you're right, you are too fat. Let's put you on Ozempic. Let's get you on weight loss management drugs. And maybe if this looks like it's doing well, we can get you on the road to a gastric bypass. We don't do that with things like anorexia, thank heavens, because we recognize that there's an underlying issue here.
The reason that this bill is so vital is there are children that are being harmed. All the way down to from 3 years old, there are children that are saying, like little Johnny saying, oh, Mommy, I think I'm a girl. And they're actually starting at a young age to start moving them over. And this is just bizarre. We didn't have this 20 years ago. This has been a big push from the left. And it just seems to me they want to sterilize children. They want to disrupt our society. Links to cultural Marxism on what's going on with this.
So my name's Dr. Clark. I'm a neurologist at CRMC. I'm also a WWAMI graduate and proud, basically lifelong Wyoming resident. I'm here with my colleagues to speak about this bill because I think it has a lot of ramifications. Firstly, I would like to express a little bit of professional offense at the language and motivation of this bill, just because I feel like I sat through that presentation and myself and my colleagues have all been accused of sort of being child abusers and child traffickers and doing all these terrible things. Obviously, as doctors, we have the care for the patient at heart. That is the thing that we are most motivated by at all times. And that's part of the reason why we are here to talk to you today. We do not do things to patients that we think are bad for them, that will harm them. I'm concerned about this bill specifically because of the lack of context. It does not seem to me that the speakers so far have had much of an opportunity to speak with people who have successfully transitioned, who are happy with their transition, which is the vast majority of the people who are treated for these conditions. There is certainly a few vocal minorities who it did not go well, but that can be said for any medical treatment and any surgery that someone may undergo. So to that point, if you have someone who is a child who has to think about getting treatment for cancer, that can be quite horrific from the outside view. The radiation, the surgery, the medications, what it looks like you are putting that child through can be very horrible taken out of context. And it may be after the fact that that child did not have a good outcome and that child and that family comes to a public outlet and makes that their story. But that really does not represent the people who have gone through something taken out of context, which might seem horrifying, come out on the other side. That child has outlived their cancer and is now living a happy life. They are in a better place. That I think is something that has to be taken into account.
Here's something else I'm not supposed to say. Ain't but two genders. Two genders. Ain't nothing but men and women. And I can already see WRL out there, they licking their pencils around, trying to write fierce as they can. Get every word of this here. Get every word of this. You can go to the doctor and get cut up. You can go down to the dress shop and get made up. You can go down there and get drugged up. But at the end of the day, you were just a drugged up, dressed up, made up, cut up man or woman. You ain't changed what God put in you, that DNA. You can't transcend God's creation. I don't care how hard you try. The transgender movement in this country, if there's a movement in this country that is demonic and that is full of the spirit of Antichrist, it is the transgender movement. It's time for grown-ups and time for Christians to start standing up and being unafraid to tell the truth. Come after me if you want to. I don't care. You want my head? Here it is right here. Come on, come get it. I don't care because it's time for us to stand up. Now, I'm not afraid to stand up and tell the truth about that issue. They're dragging our kids down into the pit of hell, trying to teach them that mess in our schools. Tell you like this, that ain't got no place at no school. 2 + 2 don't equal transgender. It equals 4. We need to get back to teaching them how to read instead of teaching them how to go to hell. Yeah, I said it and I mean it.
My name is Chloe Cole, and I am a detransitioner. Another way to put that would be, I used to believe that I was born in the wrong body, and the adults in my life whom I trusted affirmed my belief, and this caused me lifelong, irreversible harm. I speak to you today as a victim of one of the biggest medical scandals in the history of the United States of America. I speak to you in the hope that you will have the courage to bring the scandal to an end and ensure that other vulnerable teenagers, children, and young adults don't go through what I went through. At the age of 12, I began to experience what my medical team would later diagnose as gender dysphoria. I was well into an early puberty, and I was very uncomfortable with the changes that were happening to my body. I was intimidated by male attention, and when I told my parents that I felt like a boy, in retrospect, all I meant was that I hated puberty, that I wanted this newfound sexual attention to go away, that I looked up to my brothers a little bit more than I did to my sisters. I came out as transgender in a letter I sent on the dining room table. My parents were immediately concerned. They felt like they needed to get outside help from medical professionals, but this proved to be a mistake. It immediately set our entire family down a path of ideologically motivated deceit and coercion. The gender specialist I was taken to see told my parents that I needed to be put on puberty-blocking drugs right away. They asked my parents a simple question: would you rather have a dead daughter or a living transgender son? The choice was enough for my parents to let their guard down, and in retrospect, I can't blame them. This was the moment that we all became victims of so-called gender-affirming care. I was fast-tracked onto puberty blockers and then testosterone. The resulting menopausal-like hot flashes made focusing on school impossible. I still get joint pains and weird pops in my back, but they were far worse when I was on the blockers. A month later, when I was 13, I had my first testosterone injection. It's caused permanent changes to my body. My voice will forever be deeper, my jawline sharper, my nose longer, my bone structure permanently masculinized, my Adam's apple more prominent, my fertility unknown. I look in the mirror sometimes and I feel like a monster. I had a double mastectomy at 15. They tested my amputated breast for cancer. And I was cancer-free, of course. I was perfectly healthy. There was nothing wrong with my still developing body or my breasts, other than that, as an insecure teenage girl, I felt awkward about it. After my breasts were taken away from me, the tissue was incinerated. Before I was able to legally drive, I had a huge part of my future womanhood taken from me. I will never be able to breastfeed. I struggle to look at myself in the mirror at times. I still struggle to this day with sexual dysfunction. And I have massive scars across my chest. And the skin grafts that they took of my nipples are weeping fluid today. And they were grafted into a more masculine positioning, they said. After surgery, my grades in school plummeted. Everything that I went through did nothing to address my underlying mental health issues that I had. And my doctors, with their theories on gender, thought that all my problems would go away as soon as I was surgically transformed into something that vaguely resembled a boy. Their theories were wrong. The drugs and surgeries changed my body, but they did not and could not change the basic reality that I am and forever will be a female. When my specialist first told my parents that they could have a dead daughter or a live transgender son, I wasn't suicidal. I was a happy child who struggled because she was different. However, at 16, after my surgery, I did become suicidal. I'm doing better now, but my parents almost got the dead daughter promised to them by my doctors. My doctors had almost created the very nightmare they said they were trying to avoid. So what message do I want to bring to American teenagers and their families? I didn't need to be lied to. I needed compassion. I needed to be loved. I needed to be given therapy to help me work through my issues, not affirm to my delusion that by transforming into a boy, it would solve all my problems. We need to stop telling 12-year-olds that they were born wrong, that they are right to reject their own bodies and feel uncomfortable with their own skin. We need to stop telling children that puberty is an option, that they can choose what kind of puberty they will go through, just so they can choose what clothes to wear or what music to listen to. Puberty is a rite of passage to adulthood, not a disease to be mitigated. Today, I should be at home with my family celebrating my 19th birthday, and instead I'm making a desperate plea to my elected representatives. Learn the lessons from other medical scandals like the opioid crisis, to recognize that doctors are human too, and sometimes they are wrong. My childhood was ruined along with thousands of detransitioners that I know through our networks. This needs to stop. You alone can stop it. Enough children have already been victimized by this barbaric pseudoscience. Please let me be your final warning. Thank you.
We're living in a day of deception. We all know that no one has been able to change a male into a female or a female into a male. We are setting these children up for a hope that is misguided.
Two genders,